Ellen, it's Adam and Paul. How you doing?
I
I
am
I
great,
must have been
thanks.
drinking when I transcribed your number because totally different. Weird.
Because
Well,
whoever
welcome
you
home.
called didn't know what you were. Thank you, thank you.
Yeah. Well, welcome. Where were you? I forgot which island you were at.
I was in the Dominican Republic in
Ooh,
Santiago.
nice. Sorry, I'm changing your infographic here. I didn't do this until late last night, so um, yeah, I probably got about as much sleep as you did last night. We were here very late working on the conference, so there we go. All right, all set, good to
Okay.
go. So
Good to go. So, when you go into these VOSH areas, you go to very small communities in the Dominican Republic. Is that what happens? You
So
don't,
in the Dominican Republic, I'm affiliated with a sustainable clinic called ILAC, which is Institute for Latin American Concerns, and so it's a huge compound with a hospital and a surgical suite, and they have about 110 cooperadores located in the rural communities. So these are healthcare workers that work with their local communities on identifying people that have needs. And then the complex that I'm affiliated with, orthopedic surgeons were there the week before, and then we were there. And then as we were leaving, they had hernia surgeons coming in, and then they'll have physicians, ophthalmology from New York Eye and Ear that will be coming in March, and then a glaucoma specialist that comes the week after that. And so we have the option of either staying on site in the clinic or going to the rural areas. It kind of depends on the number of people that need to be seen.
right. So maybe you could give us a little background for folks who don't know what VOSH does. You know, maybe just start from the beginning, because I know that there are some folks out there who may not know.
Yeah, so VOSH stands for Volunteer Optometric Services to Humanity. It's an organization that started in the 1970s in Kansas, where a couple of optometrists and an ophthalmologist went to Matamoros, Mexico, and did outreach clinic. And it kind of grew into this global entity. We now have 88 chapters internationally. About half of those are student VOSH chapters, and so our chapters go on mission trips where they hold clinics or they go to schools. They go support places that need help, and our international chapter provides them with best practice guidelines and suggestions and guidance and that type of thing.
did you have students with you as well, or were just practitioners?
I did not on this trip. I did last year because I went a week earlier and the students hadn't started back to school. So we do like to have students along. It's a wonderful opportunity and a great learning experience for them with their retinoscopy skills and so much pathology that they wouldn't necessarily see here in the United States as a student.
And it's an inspiration to many of the students. I speak firsthand because my godson, Jordan, who is now a senior partner in our practice, in my former practice, was inspired when he went to MCO, Massachusetts College of Optometry, and he went on one of the tours I guess he was a student in the late 80s. And he was so inspired that rather than come into the practice, he went on to Johns Hopkins for a master's in public health. And then he started working for Helen Keller International through that. And then he got involved with the Council on Foreign Relations. And now Jordan is very active in international health and eye care. He's now in the practice, but he only practices half-time, and half-time he spends around the world in third world countries.
So, you know, this is actually an interesting point. This can really change the direction of someone's life. And especially because, you know, I look at a lot of the pictures that you send back. You have a lot of young folks working as volunteers. And I guess for many of them, this might be their first time even in these regions.
So I got addicted to VOSH when I was a student in my third year of optometry school. And Paul, you bring up a good point. I think people that are interested in public health kind of have a strong interest in VOSH. It's not just eye care. It's also how we can make a difference globally in the lack of eye care internationally. You know, when I was a student, the term uncorrected refractive error might have been out there, but I certainly don't remember it. We were taught the leading causes of blindness with, you know, cataracts and those things, but nobody emphasized how basic and fundamental people are entitled to having a pair of glasses when they are a student at school and can't see the board, or they turn presbyopic, which is a huge devastation for their ability to provide for their family when they can no longer do their weaving or sewing or even planting their crops by hand. And so public health it's interesting. It's been an interesting growth and development for me on a personal level, moving into the presidency of VOSH International.
Did you have to take shots before you go to some of these places?
Yeah, but I've been on so many trips that on this one I did not need any boosters. I can tell you last year when we were in the Dominican Republic, we were coming out of the country and there's all these big pop-up banners on the Zika virus. And I was like, Zika? What is Zika? I mean, nobody was talking about it. But then when we came home, my husband had a health issue where we were in the emergency room the week after, and they're like, oh, we have to work you up for Zika. And I'm like, he has no symptoms of Zika. He's got like lower back pain. I think he's got a kidney stone or something. They're like, oh no, it's standard protocol. And so it is interesting traveling internationally with outbreaks of disease. And like in Santiago, I registered with the U.S. State Department and got an update from them because there were protests happening in Santo Domingo, the chapter. So you have to be careful not only of, you know, the travel and where you're at, but yeah, the health issues that you're going to face, the sanitation and supply of water. I mean, that's one of those basic things that everybody's so appreciative of, and it's so much easier to get now versus 20 years ago. But we used to bring tons of bottled water with us in our suitcases when you could check 2 pieces of luggage, and you just didn't know how easily accessible drinking water was.
Right. You know, I bet it's humbling for a lot of folks who go down there. They think they're pretty good clinicians, but when you don't have a lot of the tools at your disposal, I bet it exposes a lot of people, and it really, you know, they get a lot of on-the-job training being down there.
That is what I really liked about having the students with me last year, because I rotated them through different stations. But if we had an interesting pathology that came through, I was able to pull them all and show them the case. You learn your basic skills. Your retinoscopy is your best friend, and you get good at it, but not just for refractive errors, but also for basic pathology when you're scoping somebody. And your diagnostic abilities are definitely challenged, but more so, I think the point is when you do diagnose something, you have to have a game plan in place for what are you going to do with those patients. And so that's where the Dominican Republic is so nice, because I know the ophthalmologists are coming down in March, and they are appreciative of the fact that they're not coming down wasting their time screening patients that they can put right into cataract surgery because we've already seen them, or need a retina surgery. Or
do you have interpreters, or if you don't speak Spanish, for example? What happens?
Yeah, we do, but that's always a challenge. So I speak enough rudimentary Spanish to get the point across. The nice thing in the Dominican Republic is they speak a very basic Spanish, because a lot of them are not educated in a school setting past a certain level. So their sentence structure and ability to converse in conversational Spanish is somewhat stilted, and mine is also. But with the place we go to, the ILAC Center, since they host medical groups from the United States year-round, they do have interpreters there for us, and that's very beneficial.
Right. So I guess the next big question is, how can someone get involved if they're really interested?
Well, the big thing is go to our website, VOSH.org, and we list our clinics there. So if you want to go on a trip, I tell people, hey, look, and see where somebody's going in a place that is attractive to you and a time that you could get out of the office. And you don't have to be an optometrist. We took 4 optometrists on our trip with 3 opticians, 2 from different labs, and then 4 lay people on this trip. And you can always, even if you have no background, check acuity and escort patients and move them around. There's a lot of things that people can do. So
But,
if you want to go on a trip,
You're not going to be on the beach.
Oh, yeah. No, it's a lot of work, but you come back and you feel so good about yourself. I got back last night. I have a full week of clinic this week, but you just feel good.
That's
I
great.
can't describe the feeling, but it's a wonderful thing. So if you want to go on a trip, then go to the website. If you want to support us financially, go to the website. There's a donation button. Some people prefer that.
Right.
But, one of the new people that we took on our trip this time, she has a master's in statistics. So I said, hey, you're my statistician, and here's all the sheets, and here's the spreadsheet we want to put it into, and you got to take it home and do it. And so she's been busy working on that today. So we can.
And
The
secondhand support is our people that signed up for CE Wire. Some of them volunteered to give a portion of their fee to VOSH.
Yep.
So that was their choice, and that's how we decide on how much to contribute. So.
And meanwhile, I'm actually on your homepage right now. I'm looking at the number of upcoming clinics. You guys have a huge number of clinics. I didn't even realize how many you do each year.
Yeah, and those are the reported ones. So we do have chapters that have established clinics that they may not put on the website. Probably, I'd say there's another twice as many as what's listed on the website, but those are people that are looking for volunteers. So, we do. We have a number of campaigns that go on year-round.
Wow. Very impressive.
Okay, very impressive.
Well, great.
Okay, so we're going to be seeing you in about 2 weeks to do a full-blown radio show and it's going to be TV, I assume. So we're having pictures up.
Oh yeah. Next time around, we'll have a bunch of pictures. So you got to send me as many as you can, and we're going to show everybody what you guys have been up to.
You don't have to dress for that, but I do.
Yeah, because we won't see you. You guys will see us.
So
well, great. So Ellen, thanks.
All right. Well, thanks so much.
Yeah, thanks so much for being here, and we'll talk soon.
Okay,
All right.
Thank you
Sounds
so
good.
much.